I hope clearly audible and visible to all of you. Now clearly audible and visible. Okay. So we have gathered here today to cover our INICET November 2024 exams from the point of view of my subject, that is forensic medicine and toxicology. Okay. You all have been doing hard work. My role here right now will be to help you revise the most important topics with the help of PYQs. So we will do a retro revision of all the important questions and topics which are important for our exams. Now coming to PG exams, now INICET and NEET PG, there is not much difference as far as my subject is concerned. You will get 12 to 13 questions. That is the standard format. Okay. Very good evening to all. So namaskaram, vanakkam, assalamu alaikum, sat shri akal, ram ram, greetings to all. So keep that smile on your face, and with that smile we will revise the subject quickly. I'll be really very quick with you all, okay, so that we save our time. Now let us begin the session. One difference which you will ask me now, sir, what is the difference between NEET PG and INICET? This is the difference. The different sort of questions which are particularly asked in INICET exams. NEET PG, they ask only single best answer type questions now, but in INICET you will come across match the following type questions which are bonus questions for us as students, and multiple correct type questions, like there will be a lead question and you will be asked pick the true and false things, something like that. So we will be revising the important match the following type questions which have been asked in recent exams in the last 4 to 5 years. So I have given a coverage of last 5-year questions. That means total 10 sessions. Okay. Chalo, shuru karte hain. This came as one of the questions now. Match the following poisons with the types, means where the poison is going to act. So we all know nitric acid is a corrosive acid, and nitric acid, out of these 4 options, yes, best answer will be skin. So I can write C over here. Nux vomica, we all know Strychnus nux vomica is a spinal poison. What are the active principles in Strychnus nux vomica? Strychnine, brucin and loganin. So yes, I will say that D will match with nux vomica, also called as Cuchilla seeds. What are the spinal postures in strychnine poisoning? Opisthotonus, emprosthotonus, pleurophotonus. Which one is most commonly seen? Opisthotonus. What is opisthotonus? Backward bending of the spine like a bow. What is emprostho? Forward bending. What is pleurostho? L. L of pleurostho will tell us lateral bending. So these are the 3 spinal postures. And what is the major effect in strychnine poisoning? Seizures. Because strychnine inhibits the effect of glycine at anterior horn cells of spinal cord. Inhibitory thing is inhibited. So there is reflex excitation in the form of seizures, and there will be no post-ictal confusion. Memory of the person will be very clear. So we know everything about strychnine. Management will be treat the convulsions. Come to Dhatura. Dhatura is going to act over. I will say, yes, Dhatura can act over heart. Because what is present in Dhatura is atropine, hyoscine, hyoscyamin. Sorry, not hard. Dissection will act over heart. Dhatura will act over CNS. Sorry, my mistake. So Dissection will act over heart and Dhatura will act mainly over CNS because it mainly contains atropine, hyoscine, hyoscyamin. So our correct match the following will be CDAB in the sequence of 1, 2, 3 and 4. Okay. And what is the fatal dose of Dhatura seeds? That we should remember. Fatal dose of Dhatura is 100 to 120 seeds. 100 to 120 seeds. Out of these 4 poisons, which one is the stupefying poison? How it acts over CNS? It acts as a stupefying poison, deliriant poison. So mainly the effect in the CNS caused by Dhatura is it is stupefying in nature. Along with this, it leads to delirium. Which type of delirium? Low muttering delirium. The person speaks indistinct words. Okay. So it is a stupefying poison, means the person will become unconscious for a while. What is the stupefying dose? Half of fatal dose, 50 to 60 seeds. What is the antidote preferred in Dhatura poisoning? IV physostigmine. Okay. Because it crosses blood-brain barrier. That is why preferred. What is the antidote for Dissection poisoning? Antidote here is digibind, Fab fragment of digoxin antibody. So this is what we are going to do with each and every question. We will cover those particular topics and the terms in totality. What are the features in datura poisoning? Features like features of atropine in the body, all the secretions will be dried up. The person will get dry hot skin, dilated pupil leading to photophobia. Salivation will be decreased, so there will be dysphagia, painful swallowing, plus dysuria, painful urination leading to total absence of urination, also called as anuria. Okay. Let us move ahead to second match the following type, which was asked in recent 5 years. And this is a pet question. It will be asked again. This is a topic of sexual perversions, which is a very famous question, which is asked in every exam. So let us do the matching. You all must be knowing frotteurism is rubbing of private parts in public, PP for private parts. So I will write 4 over here. Eonism is also called as transvestism or cross-dressing, means wearing clothes of opposite gender. Okay, wearing clothes of opposite gender. So option 3 will match over here. Necrophilia is having sexual intercourse with dead bodies. Eating of dead bodies is called necrophagia. So I will write 2 over here. Algolagnia is another name for sadism. Sadism. Sadism is sexual gratification by infliction of pain. Infliction means to give. Self-infliction means to get the pain. Self means masochism. Infliction of pain, sadism. Self-infliction of pain, masochism. So keep these words very clear. Person is getting gratified by getting hurt, masochism. Person is getting gratified by hurting someone, sadism. This is how they play with us. So we should not be played upon. We should play nicely. Okay. So here the correct sequence goes with 4, 3, 2 and 1. Then the other important perversions are exhibitionism. Display of private parts in public. Exhibitionism. Okay. Then clismaphilia. Gratification obtained by rectal enema. Then you have scatologica. What is scatologica? Gratification obtained by obscene telephone calls. Obscene means dirty. Dirty telephone calls. That is called scatologica. Then fetishism. Objects become objects of sexual desire. So these are the most important perversions and you will be getting questions from this area again. Come to next one. This was little bit tricky, but it was getting solved with the help of options, because you will be given options now, like A matches with 1 matches with A, 2 matches with D, something like that. So based on that combination, you will make out the correct answer. Never leave match the following in INICET exams. Always make an attempt to solve the question. Even if you don't know about 2 things, you will be in a position to solve the question. So let us solve this one. Zinc chloride. Which one will match with zinc chloride? I will say zinc chloride goes with irritant poison. Chloral hydrate, just like the datura, is classified as a stupefying poison. So I will write D over here. Quinine, ergot, agents like quinine and ergot, they are used as ecbolics na. Ecbolics and immunogogues. There are 2 agents na which are mainly preferred for criminal abortions. One is ecbolics. What are ecbolics? Something which increases uterine contraction. And what is immunogogues? Something which increases menstrual blood flow. So the important ecbolics used to procure criminal abortion as abortifacient is quinine and ergot. So I will write A over here. And potassium carbonate, sodium carbonate, ammonium carbonate, all are potential alkalis. So I will match them with corrosives. So it was not that much difficult. Okay. Another thing which was asked in one of the exams was, what is the list of stupefying poisons? Means the differential of stupefying poisons was asked in the exams. So let us remember it like this. CCDs are stupefying in nature. CCDs. C for cannabis. 1 C is there in the option itself, that is chloral hydrate. And D for datura. These are 3 important stupefying poisons which make the person unconscious for some time. Next one. Match the following weapons with injuries. This is another set of match the following questions from my subject. And which is an easy question, comparatively very easy question. Axe is a heavy sharp edge weapon and it will lead to injuries having clean cut margins with deeper extensive damage called as chop wounds. So I will write D over here. road traffic accidents or fall from height cases. They are most important examples of blunt injuries or blunt impacts. Blunt injuries, blunt weapon or blunt impact. Blunt impact examples will be road traffic accidents or fall from height cases. So they will lead to blunt injuries. Out of these, yes, best answer goes with grazed abrasions in road traffic accidents. I can also match these cases with ring fracture, and that is a separate question of INICET exam. A person has fallen from 3rd floor and the person has landed on his feet. Which of the following is correct about this presentation, about the injuries in this person during the time of autopsy? So the correct answer was fracture of foot bones along with thoracolumbar vertebral fracture along with ring fracture. So this happens due to transmitted force impact injuries which transmits along vertebral column and can go to the foramen magnum and can cause fracture around foramen magnum, called as ring fracture. So I will match this with C. Blade is a sharp edge weapon. Blade or knife, they will match with incised wounds. Lathi or rod-like structure, they will match with tram track bruises. So DCAB is your correct sequence. Very good, Bharti. Good going. All of you do the matching in the chat box, and that will increase your confidence that whether you are able to solve it quickly or not. And always remember, INICET is all about knowledge plus time management. The more accurate and the more speedily you are solving the question, better chances of getting a good rank will be there. You will see even single liner questions, single answer type questions, they are framed in a way to eat your time. So we'll be coming across those questions. Another match the following type questions asked in recent exam. So go on answering. Ethylene glycol, we know. Ethylene glycol, what is the antidote for ethylene glycol poisoning? We know fomepizole. Fomepizole. I can write B over here. Valproate. What is valproate? Leads to increased level of ammonia in the body. So that is why levocarnitine is preferred here. HF6, hydrofluoric acid. It can match with 10% calcium gluconate as well as IV magnesium sulfate. Remember this also. So I will write A over here. Heparin antidote, you all know, unfractionated heparin. The antidote is protamine sulfate. So BDAC is your correct sequence. Motorcyclist fracture or type 2 hinge fracture can be seen in road traffic accidents. Yes, that is very correct. Yes. See, road traffic accident can lead to any sort of fracture, be it linear fissured fracture, be it diastatic fracture, except one fracture. What is that fracture? I say that road traffic accidents can lead to any sort of fracture except one. What is that exception? Quickly. One or two exceptions. In road traffic accidents, which skull fractures will not be seen? Gutter fracture and Pond's fracture. Because Pond's fracture is mainly seen in infant due to soft pliable skull bone. And second one is gutter fracture, which occurs due to tangential gunshot injuries. Other all sorts of fractures can occur in road traffic accidents. Simple. Chalo, aage badhte. So this summarizes our match the following questions. Never leave a match the following question and never be in a hurry to solve the match the following question. You just saw the effect of hurriness, na? So Datura is going to act over CNS and Dissection is going to act over heart. You should be in complete patience while solving the question. हाँ, depressed fracture भी नहीं हो सकता. Very good, Kartika. Depressed fracture, what is the most common mechanism? Depressed fracture mainly occurs due to a heavy weapon with a small surface area of impact like hammer. So depressed fracture also called as signature fracture. उसको भी exception में रख सकते हैं. Correct. एक और match the following है, which comes from snakes area. This is a repeat question. The moment you see a black color like a snake and nothing is visualized, nothing else you can appreciate, but you are seeing a total black steely color snake, go with crabs. The moment you see a snake with a spectacle shaped mark, what should strike to your mind? Common people wear spectacles, kings wear contact lenses. So common cobra will have a spectacle shaped mark. To be exact, common cobra. So cobra will match with this one. Then vipers start with V alphabet and they have got a V-shaped head. V-shaped head. So this goes with vipers. And this one, goes with python. Python actually kills the prey by encircling the prey and leads to traumatic asphyxiation. Now comes your single answer type questions. Multiple correct we will discuss in the end. And in the end, we will discuss certain important topics also, which are particularly important for INICET exams. Put your answers quickly. And always remember the target. The target to solve questions of my subject is within 15 to 30 seconds, not 1 minute. That is how we cover the subject. So ये target याद रखना है. This target you should remember in the actual exam hall, so that you save your time for new questions of other subjects. That is the thing which should be there in your mind. So answer क्या होगा? 48-year-old male comes with injuries. What is asked is what caused the lacerated injury over the scalp? What is the correct answer out of A, B, C, D? Correct answer is this one. Soft tissue when it is sandwiched between weapon and underlying bone. So that means there should be a underlying bony structure. There should be an underlying bony structure now. So there is the weapon, there is the underlying bony structure. So soft tissues are crushed, compressed or sandwiched. So that leads to split lacerations, also called as incised looking laceration. So it looks like this something, but the margins will be irregular. Margins will show you abrasions, and that is how we differentiate. Suppose next time they ask you, they make a twist like this. I have little bit of cold and cough. I hope that is not disturbing my voice now. Now I say that this lacerated wound was present with a flap of skin and soft tissues. The moment I write this and then I write what causes the injury over the scalp. Suppose I removed this word and I said that there was a flap which was covering the wound. Now what is this injury? This is not a split laceration. This now becomes avulsed laceration. What is the mechanism of avulsed laceration? Shearing force. So next time this can be a twister in the same root question. So remember, what is the mechanism of avulsed laceration? Answer is shearing force. What is the mechanism of degloving injury? Answer is shearing force. Degloving injury is a laceration where the flap is also gone. Chalo, okay? So this completes one of the questions. Come to this one. This one was one of the predictors in the one-shot revision sessions also, and actually many students got benefited in the INICET May month exam where this question was asked. So this was not a new question. It was asked way back in INICET itself. The clincher in the question was the potassium level given as 2.5. The moment you see this, you come to know that it is a hypokalemic poison. And what are the differentials which we cover in with respect to hypokalemia in toxicology? Only two poisons now. One is barium carbonate. Another one is aspirin. Should be remembered. Aspirin poisoning also leads to hypokalemia as well as hyponatremia. Along with that, a patient presenting with fever, tinnitus, that is ringing ears. Along with that, metabolic acidosis on ABG analysis or metabolic assessment, something like that can be given in the question. And the patient is showing increased levels of ketone bodies levels have been found to be raised. So all this makes your diagnosis as aspirin. Along with hypokalemia, it also leads to hyponatremia because it increases the excretion of sodium and potassium from the body. But here, what is the question? The lady has consumed white color rodenticide powder. What is this rodenticide powder leading to hypokalemia? It won't be aspirin now. So that is how you pick this to be barium carbonate. By ruling out options also you can solve the question. What is the electrolyte disturbance caused by aluminum phosphide ingestion? Always remember hypomagnesemia. Hypomagnesemia. What is the cause of fatality in cell-phos poisoning or aluminum phosphide poisoning? The cause of fatality is low levels of magnesium affecting our cardiac systems. And that is why, what is the lifesaver approach in cell-phos poisoning management? IV magnesium sulfate. What is the earliest sign of magnesium toxicity? That you all know, loss of knee jerk. Zinc phosphide is a rodenticide powder, but it is not known to cause hypokalemia. So ruled out. Warfarin does not lead to electrolyte disturbances like this. Okay. So I hope this question is very, very clear. What are the two important hypokalemic poisons? Remember, barium carbonate or white color rodenticide powder and aspirin. Aspirin you all know. Acetyl salicylic acid. This question is also an old question. Earlier it used to come as match the following declarations with their statements. This time it was made a very simple question. What was asked? Declaration of Oslo. This is also a May 2024 question. Declaration of Oslo is used for. Oslo goes with O of abortion. This is the way to remember. So there is a list of important declarations which you should remember. And this is the list. This PDF I will be sharing in the DBMCI Premier group after the end of the session. Okay, not to worry. Now come to this declaration T. T of Tokyo should be remembered with T of torture. Just the most important ones, not everything. Lisbon deals with rights of the patient. Every patient has got right for treatment. That is what is the major thing in Lisbon Declaration. Helsinki HE starts with HE, H for human, E for experimentation. So this deals with human experimentation of drugs, vaccines and clinical trials. So you should follow the ethical guidelines. Sydney D deals with death. Mainly which type of death? Brain death. Oslo O goes with O of abortion, that was asked. And Geneva, you have to remember modernized version of Hippocratic Oath. Then sir, which of the following we should remember? All the things which have been already kept bold. These are the most important declarations. Okay. Till here. So this is particularly an important question for INICET exam. So here also I can write torture goes with Tokyo. Human experimentations, Helsinki. Then hunger goes with Malta, Declaration of Malta. This can be remembered because it was one of the options of the exam this time. So every doctor, what is the role of a doctor in hunger strike cases? You should not force feed a hunger striking person. When the person becomes unconscious, then manage the case. Then you are free to do whatever. But not till the person is conscious, you cannot force feed a hunger striking person. That was what was Currency is a rule. What is Ashley's rule? Ashley's gender from sternum bone. Gender from sternum bone. So what was Ashley's rule? Combined measurement of, combined L for length of manubrium and body of the sternum. And if this is seen to be more than 149 millimeter, the sternum belongs to a male. Less than 149 millimeter, the sternum belongs to a female. Now what will be the correct answer from the given below code? 1 and 3. Now you have to mark option A to get your correct answer. This is a very tricky area, so never make a mistake in marking the actual options. So this is how we are doing the practice. This is like a practice for the actual exams. So what I have done is I have prepared the list of all the tests of insanity till date, starting from 1313 year till 1962. These are the tests of insanity, which are important ones right from here. Right from McNaughton's 1843, this McNaughton's rule came into existence, which is still followed in India, and according to the new laws, McNaughton's rule now comes under which section of Bharatiya Nyaya Samhita? Answer is 22 section of Bharatiya Nyaya Samhita. This we should remember. Okay. This is the legal test of insanity. Earlier it was 84 IPC, but IPCs, CRPCs, they are gone. So now it will come under 22 section of BNS in the new laws. Then remember irresistible impulse test, Durham's rule. After that came Durham's rule. After that came Curran's rule. So with timelines also, if you remember now, with timelines, it remains easy because sometimes they can give you earliest to latest which tests of insanity. So remember it in a sequential way. Okay. Very good. Very good. All of you are answering the correct numbers. That is very good to see. Now come to this one. This is how they eat our time in the exam hall. We are already under stress, and these questions should not create stress. With practice, your stress factor reduces. So during autopsy of fetal death case, what is the correct order of opening cavities to ascertain whether fetus was live birth or not? So normally we read the abdomen is opened before thorax. But what about head? Head is opened first. Fetus ko, what do we use in fetus cases? Hat. Hat yaad rehta hai? You can remember hat na? Head first, followed by abdomen, followed by thorax. But here you have to pick out ABC. That is a challenging thing. Means the correct sequence will be CBA. CBA means option 4 is your correct answer. Correct na? Why is abdomen opened before thorax? That reason we know. In a fetal death case, live birth or stillbirth can be assessed with the help of abdomen. But why is head opened first? Because if I don't remove head first, it becomes very difficult to remove brain in a fetal autopsy case because the fetal brain is very soft and pulpy. So what we do is, once we remove the cranial nerve attachments, in a fetus case, the fontanelles will be opened up. We remove the skull bone with the scalpel only. There is no need of any bones or chisel. So we remove the skull bone with a scalpel blade, and then we remove the dura mater, then we remove the cranial nerve attachments, and then we lift the fetus at an angle. The brain comes out on its own, so that the brain architecture is not disturbed. That is the whole purpose why head is opened first. Why abdomen is opened first? To look for the position of diaphragm. In a live birth case where respiration has taken place, diaphragm is found at 6th rib level. In a stillbirth case where no respiratory effort has been taken by the fetus, diaphragm will be at 2nd rib level. I hope the reason is also very, very clear. Okay. Those who are finding any difficulty in audio, video, just refresh your system. That will clear everything. Audio is very, very clear for every student, I think. There is no voice issue. So anyone finding any issue, just try to refresh your system or increase your quality in the YouTube. There is a section to increase the quality that will also improvise things. Now, along with this, we should also remember what are the body cavities to be opened in asphyxial deaths. What is the sequence? So in asphyxial death, my cause of death is lying inside neck area. That is correct. So what we do is, here we open head first, followed by abdomen, followed by thorax, followed by abdomen. And last to be opened will be neck. Why neck is opened last and why head is opened first? Here the reason is, if I don't remove the brain, what will happen if I dissect the neck directly in the first place? All the blood from the head area will extravasate and will dilute my antemortem bruises and hemorrhages. Okay. So that is the reason. What is the name of the artifact? If suppose neck is opened first, there will be extravasated blood over anterior cervical vertebral regions. Who discovered this for the first time? Prinsloo and Gordon. So remember their name. This is what is called Prinsloo and Gordon artifact. If this sequence is not followed by a doctor, he will create an artifact. What is artifact? Something which is physiologically unrelated to cause of death. This blood which has extravasated from the head is not responsible for causing death of the person, but it has been produced if you don't follow this protocol. Very good, very good. Prinsloo and Gordon artifact. Then which is the body cavity to be opened in poisoning cases? Here also head is opened first, followed by thorax, followed by abdomen. Why head is opened first? To get the odor of the poison. To get the odor of the poison. Because skull is a closed cavity, odor or smell of the poison is nicely contained there. I hope this topic is no more troublesome now. Let us revise the incisions also here itself. Which is the most commonly used autopsy incision? I shape. Start from sternal notch, go till pubis symphysis. Then comes Y shape. Start from acromion tip, go inframammary till xiphoid, and then go vertically till pubis. What is modified by? Start from anatomical angle of mandible or from mastoid, reach till sternal notch and then go vertically. So this is used for asphyxial deaths, to open neck. What is the incision used in fetal death cases? Inverted Y. Start from sternal notch area, just above umbilicus, move laterally to midinguinal points or to ASIS. Okay? Y-shape incision is mainly preferred in female cases, mainly in countries outside India, because we are not crossing the chest in midline. So the till pubis symphysis, this becomes modified by used for asphyxial deaths. And inverted Y will be like this. Start from sternal notch till above umbilicus, and then go laterally to both ASIS. This is inverted valve. Easy? Is it okay now? There was some technical issue. We all are dependent on virtual networks now. So the networks also play with us sometimes. Now it is okay. I hope now it is okay now. Now okay. ये सारी एक्सरसाइज फिर से कर ले, कोई बात नहीं. I will make it again. Not to worry. Just 1 second. So where we were revising the types of autopsy incisions. So let us do a quick revision. Suppose this is the dead body. Now what I will do is, I will make just a body outline so that we can remember the autopsy incisions very easily. Imagining this to be the sternum bone, okay, in the center. Now over the skin, what I will do is, I will give one incision starting from sternal notch area. We go around umbilicus so that resuturing of the dead body is easy. If I cross umbilicus, resuturing of the dead body becomes difficult. So this is the single I-shape incision, single line incision, I-shape, most commonly used incision. Then comes Y-shape, where we go inframammary starting from shoulder tip. We reach till xiphoid and then we go vertically till pubis symphysis. This is Y-shape, mainly preferred in female deaths outside India, where cosmetic integrity of the dead body is maintained. Then comes modified Y, where we start from angle of mandible or from mastoid, depending on the case presentation. Then we reach till sternal notch and then I go vertically till pubis. This becomes modified Y, used for asphyxial deaths. And then comes inverted Y, where I will start from sternal notch area itself. I will go till above umbilicus and then I will go laterally to both ASIS or mid-inguinal points. So this is used for fetal deaths. Clear? All the 4 autopsy incisions. What are the autopsy dissection techniques? Let us revise that too. We have 4 autopsy dissection techniques now. VGRL techniques. V for Virchow's, G for GB. GB is Goens en bloc dissection. Then comes R. R for Rinsoap, Rokitansky in situ technique. And then comes L. After L comes M alphabet. This is Letourneau's en masse dissection. Which is the most commonly used? Virchow's. Which is used for infectious deaths? Rokitansky in situ, like HIV deaths, COVID deaths. Which dissection technique I will prefer where I know a known pathology written in the medical records, like cardiac tamponade. There is a known case of cardiac tamponade brought for autopsy. Which autopsy dissection technique will be preferred by me? GB technique. What is GB technique? We go according to the cavities. Thoracic cavity, abdominal cavity, pelvic cavity. My cause of death is lying in the thoracic cavity. I will dissect the thoracic cavity first. I will find out my cause of death. I will become very happy. I will have that smile on my face. And then I will conclude the autopsy in a quick way by dissecting the abdominal cavity and pelvic cavity organs. So there I will prefer Goens en bloc dissection. Correct? And Letourneau's is where I want to keep the anatomical integrity between the organs maintained. So there I will remove tongue to prostate or rectum in one mass. Okay. So in the name of VDRL test for Treponema pallidum, remember VGRL techniques. Mnemonic कोई सा भी बना लो जो तुम्हारे को सूट करता हो ना, whatever suits you, you are free to use that mnemonic. So VDRL in microbiology is used to monitor treatment outcome of Treponema pallidum. VGRL is our autopsy dissection techniques. Come to next question. This was asked recently. Basically, this is a practical thing which is done by our department only. We do the examination of drunken people brought by a policeman. Okay, sir, this person was found somewhere and let us do an examination whether he is drunken or not. So how do we give opinion in drunkenness case? That was asked in the exams. So the question here says, that he had alcohol smell coming from his airways with conjunctival redness. He was able to walk stably and had motor functions normal. That means he has consumed alcohol because odor is present. So if the odor of the alcohol is present, but motor functions, MF for motor functions, if they are normal, then we give the opinion like option B. When can answer become option A? If the odor is also absent and motor functions are normal. That means he did not consume alcohol. When can answer become option C? Next time, if they write that odor is present and motor functions have become abnormal. The moment you see the person is not able to walk stably, he is having a drunken gait, he is not listening to your commands, we give the opinion like this. He is under the influence. Not under the influence means motor functions are normal. So these are the three ways of giving the opinion in drunkenness cases. Okay. Chalo, आगे बढ़ते हैं. This was the most simple question of INICET May month exam. Injury as noted in the skull bone is due to. It will be due to a bullet injury because what you are seeing is a clean hole in the outer table. So basically this tells us that this is the entry wound area. So what is this type of wound where clean hole is seen in the outer table and chipping of the skull table will be present on the inner table? That is what is called as beveling. So basically the question was being asked with respect to beveling. So in entry wound, beveling is seen mainly on the inner table. In exit wound, when the bullet goes through and through the brain, now beveling will be seen on the outer table. Means exit wound, beveling is on outer table. So in entry, beveling will be seen on inner table. In exit, beveling is seen on outer table. So here the answer goes with. Now suppose I show you a gutter-like fracture. That also will go with bullet injuries. Let us see the variations. Suppose I show you a gutter-like fracture. That also goes with bullet injuries, tangential bullet injuries. Suppose I show you a depressed fracture. Then the answer will become hammer. Okay. Rod will lead to comminuted fractures or can lead to linear fissured fractures. Next one. What is the antidote for cyanide toxicity? Antidote is amyl nitrate, sodium thiosulfate, ABC. B is your correct answer. Okay? Without any doubt. What other antidote is available to us? Other antidote available to us is IV hydroxycobalamin injections. Hydroxycobalamin injections. Which one is a direct binding agent? We know hydroxycobalamin. Nitrites, basically they are methemoglobin generators. They will increase the levels of methemoglobin, which displaces cyanide cytochrome complexes. But the product which is formed is water insoluble. So to make the product soluble comes the role of thiosulfate. Okay? So what is more important is nitrites, amyl nitrite, sodium nitrite. Lily's kit consisting of amyl nitrite, sodium nitrite and sodium thiosulfate. How will you diagnose a cyanide poisoning case? Which cases you will be managing? Actually, practically speaking, you will never manage throughout your life a case of cyanide tablet ingestion. You will be managing those cases who are still alive and coming from flame burn cases. So the moment you see a person coming to casualty with a history of flame burn, but the person is showing you a bright red color change in the skin, the person is giving out a better almond odor, and the person is telling you, Doctor Saab, I am not able to breathe because I am having a constriction in my throat and chest. Because cyanide is one of the agents which lead to histotoxic hypoxia. So now you can easily diagnose the case and then you will give the antidotes to manage the case. Remember one thing, 1 or 2 points which are very special for cyanides. Which is the organ which is always to be preserved in cyanide poisoning case? Other than the routine organs, spleen. Maximum chances of detection of cyanide is from splenic sinusoids. And what is that finding which I will note in the eyes of the person and I can say that it is going towards cyanide poisoning? That will be seen in a living person also sometimes, but during the time of autopsy it is very obvious. Glassy prominent eyes. The eyes like this. So that go with cyanide poisoning. Glassy prominent eyes. What was the question being asked by Shiv Kumar? Let us take the question side by side. Penetrative rod injury will look like same. Penetrative injury is injury entering a cavity. See, rod. अच्छा, इसमें पूछ रहे हो रॉड इंजरी, तो इतना थोड़ी सोच लोगे कि पेनिट्रेटिव रॉड इंजरी है. अगर बुलेट और रॉड में से देखो, तुम्हारा सोचना सही है, योर थॉट प्रोसेस इज करेक्ट, बट यू हैव टू पिक द एक्यूरेट, मोस्ट एक्यूरेट थॉट प्रोसेस. Most accurate answer to this question will be bullet. If bullet is not in the option, then your thought process is correct. Maximum chances of detection of cyanides is from splenic sinusoids. Along with stomach, intestine, liver and kidneys, spleen will always be present because of this simple fact. चलिए आगे बढ़ते हैं. ये भी वन लाइनर क्वेश्चन है, यहां से तो हर साल ही क्वेश्चन आते हैं. From here you get question every time. Which of the following is not associated with Korsakoff psychosis? They keep on asking Wernicke's and Korsakoff repeatedly and delirium tremens. If you ask me, sir, one question sure shot. One question which is sure shot is either from Wernicke's or Korsakoff psychosis or delirium tremens. This is sure shot from these three topics. So here the answer to the question will be which is not associated with Korsakoff, ophthalmoplegia. Because ophthalmoplegia, global confusion and ataxia, they are features of Wernicke's encephalopathy. Global confusion, ophthalmoplegia, ataxia. But amnesia, confabulation. Amnesia is loss of memory. Confabulation is filling the memory gaps with false stories. And polyneuropathy to mil sakta hai na? Neuropathy can be seen in Wernicke's as well as Korsakoff. That is mainly due to the nutritional factor. So that is why your answer will go with ophthalmoplegia. What is to be given first during management of alcoholic poisoning cases? Always thiamine to be given first. Supplement thiamine so that glucose utilization can happen in the body with the help of pyruvate dehydrogenase complex. Because thiamine is used in enzyme subunit 1 of PDH complex. So if thiamine is low, supplement thiamine first and then supplement glucose in alcoholic management. See, Wernicke's encephalopathy, what are the features seen? Goa, global confusion, ophthalmoplegia, ataxia. A for ataxia. O for ophthalmoplegia, G for global confusion. Korsakoff psychosis, what are the features? After doing Goa party, the person will switch on the AC. A for amnesia here. And C for confabulation. Neuropathy can be seen in alcoholic cases. What is the type of neuropathy seen in alcoholics? Symmetrical sensory motor neuropathy. Symmetrical sensory motor neuropathy. And it can involve multiple nerves because of the nutritional factors, nutritional deficiencies. Mainly the deficiency is of B1 because alcohol mainly inhibits B1 absorption from dietary foods. But other deficiencies will also happen in alcoholics. Next one. This is also a patent question. A patient presents with paresthesias, tetany, muscle twitches and muscle cramps with urinary crystals as shown in image. These are typical symptoms of poisoning with. Simple answer, calcium oxalate. To be exact, bihydrate crystals. Now tell me answer to one question. This answer you have marked now. Now answer one more question. That this patient has consumed ink remover solution. I give you something like this. Which poison you will think of? Answer. A patient presents with these features after consuming ink remover type of solution. And these typical symptoms of poisoning occurs due to calcium oxalate bihydrate crystals. But what is the diagnosis? What is the poison? Answer. अभी मोनोहाइड्रेट पे बाद में आएंगे, पहले इसका आंसर बताओ. Ink remover solution goes with oxalic acid. Oxalic acid. Suppose I make a twist in the question and I write that this patient has consumed something which is used in vehicle coolant pipes as antifreeze. then your diagnosis will go with ethylene glycol. ठीक है, so ये हमेशा ध्यान में रखना है, नहीं इंक रिमूवर इथिलीन ग्लाइकॉल नहीं होता, वहां आंसर ऑक्सैलिक एसिड जाएगा. So both of them can give rise to calcium oxalate crystal formation. I hope this crux is known to all. If it is not known to all, we can revise this. That always remember, ethyl alcohol, methyl alcohol, and ethylene glycol all are alcohol groups metabolized by the same enzymes in different steps to acetaldehyde here, formaldehyde here, glycol aldehyde here. Then aldehyde dehydrogenases come into play in the liver, and what is formed in the first step is acetic acid, in the second step formic acid, and in the third step glycolic acid. But this glycolic acid is further metabolized into formic and oxalic acid, and this is how a case of oxalic acid poisoning, ethylene glycol poisoning, can present with oxalic acid poisoning, because it is one of the terminal metabolites along with formic acid. So which metabolites are formed in which metabolism was asked in NEET PG 2024, and it was getting solved very easily. In all these steps, yes, lactic acidosis usually is there because of alteration of NADH NAD plus ratio. So lactic acidosis and formic acid will be seen if a person consumes methanol. What is that tragedy called if many people consume illicit liquor containing methanol? That tragedy is called Hooch tragedy. Hooch tragedy. So if these cases are brought to you as a doctor, how will you manage them? They have consumed bad alcohol. We will give them good alcohol. We will give them IV ethyl alcohol through IV route, not through oral route, because alcohol dehydrogenases, they are in love with ethyl alcohol. They have very high affinity for ethyl alcohol as compared to methyl alcohol. What is the antidote for ethylene glycol? We all know, fomepizole. Okay? So that is how your answers can change. And these are the three crystals which are again repeatedly asked. Envelope shaped crystals are calcium oxalate bihydrate. Dumbbell shaped ones are calcium oxalate monohydrate. Which ones are mainly seen in poisoning cases? Bihydrate ones. Majority crystals in urine will be of envelope shaped. Coffin lid shaped crystals are also asked as image based questions. They are struvite crystals, mainly triple phosphate crystals like this. Coffin lid shaped crystals. Come to next one. What do you mean by bullet pipe seen on the wound surface? What is correct about bullet pipe seen on the wound? Bullet pipe is another name for grease collar. So this is grease or dirt collar. Grease or dirt collar. So the correct answer will be anything which is being brought by the bullet from the barrel. So that goes with bullet pipe. This is a simple question. These are like very, very simple questions. They should be answered like this within 2 to 3 seconds. All of the following causes meiosis except belladonna will be your answer. This is total Atropa belladonna. Atropine is a dilator, no? That we all know. So Atropa belladonna plant gives us atropine, and atropine is a mydriatic. So let us do the differentials of meiosis here. In relation to meiosis, remember carbolic acid, chloral hydrate, then barbiturates are also miotics, barbiturates like phenobarbital, and they are acidic drugs also, mild acidic drugs. Then comes two O's. One is OPCs as well as carbamates. Along with this, also remember opioid agents. And remember, pontine hemorrhage cases which lead to postmortem caloricity in dead person can lead to bilateral meiosis when the person was still alive. So this is a comprehensive list of miotics. So what is the comprehensive list of mydriatics? Here we can keep datura because it contains traces of atropine in it. Along with this, remember cocaine, LSD, and amphetamines. Amphetamines. Done. So meiotic, mydriatic is an important question area. Actually, if it is a lengthy question, these clinchers will help you pinpoint your answer. Come to this one. This one is a patent question asked in every exam every year. In a chronic alcoholic, delirium tremens occurs due to all except. The correct answer is gradual withdrawal. So these are like the predisposing factors. Why sudden withdrawal is very essential? We know now, we have covered in our classes that overall ethyl alcohol is a CNS depressant, because overall ethyl alcohol decreases the effect of positive neurotransmitters like glutamate and increases the activity of inhibitory neurotransmitters like GABA. When a person leaves alcohol suddenly, what happens is reversal of this neurotransmitter effect, leading to delirium, tremors, agitations, seizures, hallucinations, and the person becomes a case of delirium tremens. What is another predisposing factor? If the person is admitted in hospitals with acute infection, shock due to injury, the doctor will not give him alcohol. That drink alcohol, otherwise you will become a delirium tremens case. So this was our NEET PG 2024 question. There is a chronic alcoholic who has met with road traffic accident. The person has been brought to hospital. What should the doctor do to prevent delirium tremens features? There the answer was going with lorazepam. To manage cases of delirium tremens, we give IV lorazepam or oxazepam. So there also we can utilize lorazepam to control, to prevent any seizures happening in the person. Okay. Next one. 11-year-old girl was found inattentive in class, also cried sometimes. On further inquiry, principal came to know that uncle of the girl had been touching her genitals inappropriately at home. Who should the principal inform first? Any person coming to know that an offense, sexual offense, has occurred with a child, they should inform police officials first. So always remember, police first. And it is the duty of the police to inform the parents, and they will also inform the child welfare officer. Okay. So there are few things which are important for INICET exam, particularly like POCSO Act. So basically what they ask is whether you know some basic details of POCSO Act or not. So this act was first made in 2012 and changes were done with respect to rape laws. Parallel changes happens in POCSO Act. So in rape laws changes, last changes were done in 2019. So the changes in POCSO Act were also done in 2019. So according to POCSO Act, there are certain offenses which we should know. One offense is penetrative sexual assault. Penetrative sexual assault can be done with a male child as well as female child. That is the difference between POCSO Act and rape laws. It is to protection of child from sexual offenses. And child is a person less than 18. This child can be either a male child or a female child. That is why we say na POCSO Act is gender neutral. So this is almost synonymous to rape definition with that difference. Rape is one way, male to a female. PSA, I can write this as PSA now. PSA is gender neutral. Then another important offense in POCSO Act is sexual assault. Sexual assault simply means touching of private parts of a male or a female child. Just remember the word touching. Touching of private parts, obviously. So touching of PP means private parts of a child, like breast area is also covered there. Penis of a male child is covered, vagina and urethra, those areas are covered. So these two offenses should be remembered. Then they asked in one of the INICET exams, in AIMS exam particularly, when Central Institute exam happened to be separately. What do you mean by aggravated offense under POCSO Act? Aggravated section when added, when this word is added, it can be aggravated PSA, it can be aggravated SA. Aggravated one simply means punishment to the accused will increase. So when is this clause added before the offense? When it is found that the accused was a person who was unknown to the victim. This is one situation, like a relative, like the neighbor. So the child will have a confidence in that person because that is a known to person to the child. So those people, if they are accused, the offense becomes aggravated. So I can write any person who is knowing the child known to. Other will be any person in which the child was having a confidence. So we all have confidence in police department, security forces, people holding high chairs like heads of religious institution, educational institution. All these people hold a high chair in which the child is having a confidence. So there also any person in authority is the word written in the law. In authority, it means in whom the child was having the confidence. So there the offense becomes aggravated. What is the offense which the uncle was found to be doing here? Now answer. Suppose they next time ask you, what is the offense which this uncle is doing? Options are PSA, SA, aggravated PSA, aggravated SA. So your answer will be aggravated SA. Because the uncle is a known relative, the offense will become aggravated. What is the offense which he was doing? He was found to be touching her genitals. I hope it is clear. Then any person comes to know that a sexual offense has occurred with a child, they should have to inform the police officials, and it is the duty of the police to get the medical examination of the child done within 1 day. It is the duty of the police to get the child welfare committee involved within 1 day, so that after care of the child can be taken. This came as a spotter question. Identify the plant image causing delirium. The answer goes with erythroxylon cocoa, and from this plant, from the leaves mainly, from the leaves. What is obtained from the leaves? After treating the leaves with concentrated H2SO4, HCl, what is obtained from the leaves is cocaine. What is obtained is cocaine. Next one. This is also like a spotter question. Identify the post-mortem change in the image. The answer goes with marbling. Marbling. So few important facts about marbling. Marbling occurs, marbling is greenish discoloration of superficial veins mainly seen over chest, arms, lower abdomen and inner side of thighs. These are the areas where marbling is mainly seen. So this greenish discoloration occurs due to sulfhemoglobin pigment. That is the green color pigment. Then this marbling process begins at what time? So we all know it starts at around 24 hours due to bacterial putrefaction only. But this process is happening inside the vein. But externally it is seen by us or visible to us. Then the answer becomes at least 12 hours to it. Means 36 hours to 48 hours. And it is due to bacterial putrefaction. So we know all the important things about marbling. With regards to filigree burns, we will revise filigree burns with another separate question. Now, next question. A 22-year-old female body was brought for autopsy. The autopsy doctor noted hemorrhages in the eyes, bruises and abrasions over neck, extravasation of blood in the neck tissues and muscles. Nothing will be visualized in these internal finding images. Externally, you can appreciate that the findings are mainly present over this part of the neck, that is the front and lateral side of the neck, in the form of abrasions and bruises, plus hemorrhages in the eyes. Take your answer towards throttling cases. And throttling is manual strangulation of a person, where the strangulation is done by hands. When you strangulate a person by the hands. So the pressure by the fingertips, they lead to small round bruises called sixpenny bruises, and the fingernails can lead to scratch abrasions mainly. Next one. Iska answer batao. Answer this one quickly. Identify the range of firearm weapon injury as shown in the image. What you are saying is these are pellet wounds. So you will never confuse them with tattooing. Tattooing is a stippled appearance, just dotted appear. Tattooing will be like this. These are actual defects in the skin. So they have been caused due to Shotguns. So rifled option is gone. Now this is in intermediate range or distant range? Answer is this is distant range, to be exact, more than 400 centimeters. Because what you are seeing over here is individual pellet wounds. There is no rat hole with satellite wounds. When will option C become your answer? When I show you something like this, a irregular wound with satellite wounds, then your answer will become option C. When will your answer become option A? When I show you only a rat hole entry. Okay. So never mark these questions wrong. This topic I hope everyone has covered nicely and revise it nicely. You get one question. In this year NEET PG 2024 also you got one question from range topic from the ballistics. So revise this topic nicely from the main notes. इसका आंसर बताओ. What is true about PSV? Polyvalent anti-snake venom. What is true? What is true? Let us see the options. Lower dose in infant as compared to adults. Wrong. Before giving ASV, sensitivity testing done. Wrong. Useful for venom associated coagulopathy in viper bites. This is true. Cobra venom acts presynaptically. Wrong. Cobra venom acts over postsynaptic receptor area. कहाँ बिग है? कहीं बिग नहीं है. बिग कहीं नहीं है. ये सब स्मॉल वुंड्स है. ये एक जगह यहाँ पे ऐसे ना सारे इंडिविजुअल वुंड्स है. कोई भी आइसोलेटेड ऐसा इंजरी नहीं है. ओके. अगर आइसोलेटेड इंजरी होता ना, देन द आंसर विल गो विथ मोर देन 200 सेंटीमीटर. चलो, तो let us focus towards here. So what is the initial dose of PSV? 8 to 10 vials. Is it same in every person? Yes, because the amount of venom injected by the snake will be same. Snake will inject the same venom, na? Whether the person is a male, female. So the initial dose is same in every person, irrespective of age, race, gender. Before giving ASV, sensitivity testing is not recommended. If the person goes in anaphylaxis, give ADR injections. When the anaphylaxis is settled, what you have to give is PSV only. So give it as early as possible without any testing. Okay. Then cobra venom acts over postsynaptic receptor area along with banded crab venom. So these two venoms, they act over postsynaptic receptor area. Which venom acts over presynaptic receptor area? We know common crab. Common crab venom acts over presynaptic area. Please explain difference between close and intermediate of shotgun. Dekho. If you want to revise this topic, na, revise it like this. Just listen what I am saying. I will not write anything. Imagine this to be the barrel of a weapon. This is white colored. Okay. This is visible over here. Suppose the weapon is like this. Okay. This is contact shot. In contact shot, where the muzzle end is in contact with the skin, you know about discharges, na? Singeing, blackening, tattooing caused by flame, smoke particles and unburnt gunpowder particles. That you all know. That I am taking into account. Flame leads to singeing of hairs. Smoke leads to blackening of epidermis. Unburnt gunpowder particles lead to tattooing of dermis. So if I have kept the muzzle end in contact shot, all the discharges will go inside. Effects will be mainly seen in the track of the wound, in the soft tissues, inside the body. If I increase the distance of the muzzle end from the target, okay, like over here. So now I say flame is reaching the skin. Flame is reaching the skin. But if flame is reaching the skin, that means smoke and unburnt particles will also reach the skin. Means if singeing is present, blackening and tattooing has to be there. If I say further increase the distance, now flame is gone over here, but tattooing is present. So that makes it intermediate range. If nothing is present, that means distant range. This is very clear about the effects. Coming to entry wounds. In relation to contact shot over head area, what happens is all the discharges and the bullet and the pellet, whatever may be the type of weapon, what will happen? Everything is going inside. The skull bone gives a resistance and you get an exaggerated form of split laceration. called as star shape entry wound, stellate shape entry wound, or cruciate shape entry wound. Correct? What about the discharges? In the track of the wound. In cases of rifled entry, star shape. In cases of shotgun entry overhead, star shape. Entry wound is same. Now, in cases of rifled entry, other than contact overhead, everywhere we will get a round entry. Because the bullet, there is a projectile which is single bullet. Bullet comes with a spinning motion and makes a round entry. Simple. Variations happen in shotgun weapon. Why? Because there what is coming out from the barrel is pellets. As you increase the distance, dispersion of the pellets will increase. So what is happening is, if the shotgun is fired in close range, now what will happen is, still the pellet unity is maintained. So all the pellets are reaching the skin and they are stretching the skin and they are making an oval entry. If you further increase the distance, now the pellets will disperse. And now they will create a sort of irregular oval wound, which is called as rat hole wound, having irregular margins. Okay. If I further increase the distance, matlab distant shot means distant shot. So in distant shot, now there are two important variations. At a particular distance more than 2 meters, or I say 200 centimeters, you will get a rat hole surrounded by satellite wounds. Some widely dispersed pellets and some central pellets. So there you will get a picture of rat hole surrounded by satellite wounds. If I further increase the distance, all the pellets will be dispersed. And that is how you create a injury like this. Individual pellet wounds. If I further increase the distance, the pellets will be dispersed. Like here, they are involving one partner, left this cubite, left iliac fossa area. If I further increase the distance, they can involve abdomen as well as chest as well as sometimes neck also. So dispersion, as it increases, the area involved over the body surface will also increase. I hope this is clear now, Karthik, and to other students also. Then come to next question. 18-year-old female was sexually assaulted by a male. White stain was present on the clothes of the victim. Barberio's test was performed on the stains to detect which of the following. Simple है ना? Barberio's में crystals किसके बनते हैं? Spermin picrate. Spermin picrate. What is the reagent used? Picric acid. What is the source of a spermin? Spermin comes from prostate having R alphabet. That is how we remember. So which test is based on prostatic secretions? Barberio's R also correlates with this. What is the test where I say, suppose I say Florence test was done, then what will be your answer? In the same question, instead of Barberio, suppose Florence is in the question lines. Now what will be the answer? Now your answer will be choline. Because what is the crystals made up of in Florence testing? Choline iodide. Iodine is added as a reagent. And what is the source of choline in the sample? Seminal vesicles. Seminal vesicles. Okay. Seminal vesicles. So L of choline, L of seminal vesicle, L of Florence. Everything correlates nicely. And the crystals spermin picrate are yellow color needle shaped crystals. Florence crystals are dark brown rhombic shaped crystals. Okay? This topic is also very important topic, is stain analysis, crystals and all. Okay. Most common mode of inorganic lead poisoning in industrial workers. Workers may, it is inhalation of lead dust particles. The same question for a child age group person. Suppose it is asked lead poisoning in child age group person, what is the most common route of lead poisoning? So now it is ingestion. Mainly due to licking of soft toys. Mainly due to licking of soft toys by the kid. Soft toys have got paint in it. Paint has got lead in it. कोई नहीं पूछने वाला है फॉर्मूला डिस्पर्शन ऑफ पेलेट, वो छोड़ दो, वो फालतू का एक क्वेश्चन घूमता है ना मार्केट में, छोड़ दो उसको मार्केट में ही रहने दो। तुम्हें बैलिस्टिक एक्सपर्ट नहीं बनना है, एग्जामिनर्स को भी पता है कि तुम्हें बैलिस्टिक एक्सपर्ट नहीं बनना है, एक्चुअल एग्जाम में कभी नहीं आएगा, आएगा तो सारे ही लोग गलत करेंगे, तो छोड़ दो ना, वैसी चीजों के पीछे क्यों पढ़ना, विच इज द रेयरेस्ट ऑफ द रेयर ऑफ द रेयरेस्ट, तो वैसी चीजों के पीछे नहीं पढ़ना चाहिए। पढ़ो वैसी चीजों के पीछे ना विच आर कॉमनली आस्क्ड और विच आर रेयरली आस्क्ड, नॉट रेयर ऑफ द रेयरेस्ट, उसके पीछे नहीं पढ़ना है कभी भी। A person with firearm injury with only abrasion collar seen, identify the range. A person with firearm injury with only abrasion collar seen, actually something is missing in the question, I think. यहाँ पर एक चीज डाल देते हैं, a person with firearm injury having round entry with only abrasion collar noted. Now the question is complete. Firearm injury having round entry with only abrasion collar, what is the range? The answer goes with distant. Very good, very good. क्योंकि इफेक्ट्स के बारे में कुछ नहीं लिखा है ना, तो दे आर टू बी टेकन एब्सेंट. Nothing is written about the effects, singeing, blackening, tattooing. So take them to be absent. They are absent in distant range. Please explain. Rahil is asking gold standard for blood and sperm. इसको पूरा ही रिवाइज कर लेते हैं क्विकली. देखो आधा अधूरा ना मुझे रिवाइज करने में मजा नहीं आता, आपको भी मजा नहीं आएगा, तो ये ना पूरा ही एक बार क्विकली रिवाइज कर लेते हैं विद इन 2 मिनट्स. 1 मिनट फॉर रेड स्टेन्स, 1 मिनट फॉर व्हाइट स्टेन्स. कैसे रिवाइज करते हैं? अगर स्क्रीनिंग पूछे कि व्हाट इज द स्क्रीनिंग टेस्ट ऑफ चॉइस फॉर रेड स्टेन्स, तो याद रखना है लुमिनॉल स्प्रे, करेक्ट ना? सो वी स्प्रे दिस लुमिनॉल स्प्रे. इफ आई गेट even one part of blood is there in 10 million parts, I will get a bluish luminescence from that area, and luminol spray is made up of sodium carbonate and sodium perborate. And additional advantage is for it can be used for old washed stains. Then what is the most gold standard जो तुम पूछ रहे थे ना, gold standard confirmatory for red stains is spectroscopic examination of the sample. So what we obtain here is different band patterns of different hemoglobin pigments. So in a petrified stain sample, there will be self-hemoglobin pigment, fresh blood, oxyhemoglobin. So there I will get different band patterns of different hemoglobin pigments. So that is why it is gold standard, because it is towards detection of hemoglobin pigment, which will not be found in any other red stains like cranberry juice, strawberry juice. उसमें hemoglobin pigment तो नहीं आएगा ना कहीं से, ठीक है? So that is why it is gold standard confirmatory or a most specific test. And then there are 2 microscopic crystal tests, Teekmans and Takayama. TT test, table tennis bat is red color on one side. That is how we remember. So Teekmans में the output is light brown rhombic crystals. In Takayama the output is pink feathery crystals. खत्म. Come to white stains. Screening कैसे करते हैं? Either by ultraviolet light. After using a sperm tracker solution, we switch on the ultraviolet light. If I get bluish fluorescence, I have screened the sample. यहाँ पर और भी modalities हैं screening के लिए. Here we can use Brentamin testing, which is also called as Walker test, which is based on which enzyme levels in the seminal stain, which enzymes are present in high levels, which gives Brentamin test or Walker test positive. Answer is acid phosphatase enzyme. That comes from prostate. Then comes, we can assess CPK levels also, creatine, phosphokinase level. These are all used for screening a white stain sample, whether it is semen or not. Okay. Then how will you confirm the sample? So for confirmation, what should be present in the sample that it will be semen and not vanilla ice cream? What should not be present in vanilla ice cream? Spermatozoa. But what should be present if the sample is to be semen? Spermatozoa. So if you look at one intact spermatozoa, yes, my sample will be semen and nothing else. But in cases of agiospermia, now gold standard confirmatory cannot be sperm na, because the spermatozoa is already absent there. So agiospermia में gold standard confirmatory क्या होगा? Raised levels of again acid phosphatase enzyme. Along with this enzyme, raised levels of prostate specific antigen को भी measure कर लेते हैं, P30 antigen. So this is how. And then the microscopic tests are boyfriend tests. A boy will have semen sample, so we have Barbarios and Florence testing. Spermin picrate crystals, choline iodide crystals. Spermin picrate is yellow needle shape, फ्लोरेंस इज डार्क ब्राउन ब्रोम्बिक शेप. टॉपिक ही खत्म हो गया. अब ये सैंपल ह्यूमन का है कि एनिमल का है, इसके लिए कौन से टेस्ट अवेलेबल है? स्पीसीज डिफरेंशिएशन के लिए. सो फॉर स्पीसीज डिफरेंशिएशन whether the sample is human or animal, we have precipitin test. In one exam, precipitin was not in the option. So remember, DNA of human and animal will be different. तो DNA analysis भी कर सकते हैं. Simple. पूरा का पूरा टॉपिक ही रिवाइज हो गया आपका. लीड पॉइंट्स, ऑल द इंपॉर्टेंट लीड पॉइंट्स. यही रिवाइज करना चाहिए एग्जाम से पहले, लाइक दिस. देखा कितना छोटे स्पेस में हो गया ना. एक स्टिकी नोट बनाओ, स्टेन एनालिसिस खत्म. वन क्वेश्चन श्योर शॉट. So these are very very high yield topics. चलो आगे बढ़ते हैं. अभी सिंगल टाइप के बाद मल्टीपल करेक्ट टाइप भी आएंगे. कार्बन मोनोक्साइड पॉइजनिंग लीड्स टू विच टाइप ऑफ हाइपोक्सिया? We all know anemic hypoxia. We all know anemic hypoxia will be the answer of choice. So the types of hypoxia into anemic, stagnant, histotoxic or anoxic means ASHA types was given by which fellow? Remember the name of the person who classified hypoxia into ASHA types? Gordon's. Carbon monoxide will give rise to a cherry red color change. So anemic hypoxia, remember CO poisoning where we get cherry red color change. Stagnant hypoxia due to heart failure like conditions. Heart failure will lead to stagnation of blood in blood vessels. Histotoxic hypoxia, cyanide poisoning because it inhibits complex 4. Complex 4 is inhibited by carbon monoxide also. But why hypoxia is different? Because to inhibit complex 4, the amount of carboxyhemoglobin needed in the body is much much higher. Before that, बंदा ही खत्म हो जाएगा, बंदा ही खत्म हो गया. Before that, death of the person has occurred. Because when this COHB level reaches 70 to 80 milligram percentage, death of the person occurs. To inhibit complex 4, the level needed is much higher. So that is why initially it leads to anemic hypoxia because oxygen carrying capacity of the blood is reduced. But cyanide even in low doses inhibit complex 4. Remember this simple thing. Anoxic hypoxia के लिए example है asphyxial deaths, arteriovenous shunts. They can also lead to anoxic hypoxia. As well as if the person goes to Himalaya to impress his girlfriend that I will go to Himalaya without any acclimatization. तो इम्प्रेशन तो होगा कि नहीं होगा पता नहीं, बट द पर्सन माइट डाई ड्यू टू अनॉक्सिक हाइपोक्सिया. सो इफ यू प्लान टू गो टू हाई ऑल्टीट्यूड फॉर मोटिव्स लाइक दैट, ऑलवेज डू प्रायर एक्लिमेटाइजेशन. एक्लिमेटाइजेशन के बाद योर बॉडी विल बी एक्लिमेटाइज्ड ना. सो दीज आर द डिफरेंट टाइप्स ऑफ हाइपोक्सिया इनटू एनीमिक, स्टैग्नेंट, हिस्टोटॉक्सिक, अनॉक्सिक. आगे बढ़ते हैं. अरेंज द फॉलोइंग इन द करेक्ट ऑर्डर ऑफ अकरेंस ऑफ सिम्टम्स इन एक्यूट आयरन टॉक्सिसिटी. ये पूछा गया था आयरन टॉक्सिसिटी के स्टेजिंग इन द एग्जाम्स एंड दिस वी हैव कवर्ड इन आवर क्लासेस. तो यहाँ पर करेक्ट आंसर क्या होगा? गैस्ट्रिक ब्लीडिंग इज गोइंग विद स्टेज 1, रिकवरी फेज इज स्टेज 2, metabolic acidosis, CNS complications, CVS complications in iron poisoning is said to be stage 3, and stage 4 is liver damage where the person will become jaundiced, hyperbilirubinemia and hypoglycemia will be noted. So इसका timeline भी लिख लेते हैं. Gastric bleeding or gastric necrosis is seen in the first 6 hours. Some students said ना कि timelines भी दिया हुआ था. So you should remember the timelines. In the initial 6 hours, GI findings. Then from 6 to 24 hours means till 1 day, it will appear that the person has recovered. Liver tries to compensate. But eventually the person will go into metabolic acidosis. He will present with hypotension because of this gastric bleeding episodes between 1 to 2 days. And between 2 to 4 days, his liver will be damaged. So to counter excess of iron in the body, we can remove this iron from the body by giving a specific chelator, that is desferrioxamine is the preferred chelator for acute iron toxicity. So यहाँ पर आंसर क्या हो जाएगा वो निकाल लो. क्या हो जाएगा? यही तंग करने की चीज होती है. दिस इज एन एक्ट ऑफ सैडिज्म. ABCD लिख के फिर वो सीक्वेंस यहाँ पे निकालो, नहीं तो वो आंसर गलत हो जाएगा. तुझे निकालना है आपको. कि पहले क्या आएगा बी। तो इसमें क्या करना है ना, पहले क्या आ रहा है लास्ट में क्या आ रहा है वो देख लो। लास्ट में क्या आ रहा है डी, बी पहला डी, मतलब दो ऑप्शन रूल आउट हो गए। दिस इज द वे टू अप्रोच द क्वेश्चन, दिस इज द वे टू कट दैट सैडिस्टिक इफेक्ट। तो बी पहले डी लास्ट में, तो ऑप्शन डी इज माई करेक्ट आंसर। इसके अलावा तो कुछ आंसर हो ही नहीं सकता। These are time eater questions and ऐसे टाइम बचाना है, ये सब छोटे छोटे ट्रिक्स यूज करें। A person in police custody was placed in prone position with his wrist and ankles bound behind his back and secured with a rope. तो पुलिस ने उसको ऐसे बांध कर दिया प्रोन पोजीशन में, his hand and feet are tied to the back. This method is called hog tying. Hog tying. What is Falanga method of torturing a person? Falanga is beating on. Falanga is also called bastinado. This Falanga is also called bastinado. Beating on soles. Beating is overall the most commonly used torture techniques. Then beating on ears is called telephona. These are two old repeats. और नया क्वेश्चन क्या पूछ सकते हैं कि there is a person who is being tortured like this. You are standing behind the person and you have kept your cubital fossa in the midline and you are strangulating the neck of the person like this. But what is this type of torture technique? It is not mugging. Mugging will be type of strangulation. The question is identify the torture technique in the image. So this image goes with carotid sleeper hold. Additionally, the person can be tortured like this also. Stand behind the person and hold his neck with your forearm compressing the neck. This technique of torture is called in-choke holds. So be very careful in these questions. These will be simple images. First option will be mugging and the question will be identify the torture technique. So never mark mugging there. If the question is identify the type of strangulation, both these cases will be for me at the time of autopsy. They will be cases of mugging where the strangulation is done by bend of elbow or bend of knee or sole of foot. But in relation to torture technique, the names used are different because these were the names which were found in the same question options. So you should be very, very clear with these words. Next one. Fingerprint ridges appear by. Ridges are present over the fingertips. No? So impression of these ridges is called fingerprint. So these fingerprint ridges, they appear by. Appear means their development has happened. So appears, or I say develops by. Appears by or develops by means development is completed. So this development is completed by 5 to 6 months intrauterine life. And when do they start to appear? Suppose it is like when do their development starts? So development starts at around 3 to 4 month intrauterine life. So accordingly your weeks will come as your answer. ठीक है? So development complete कब हो जाता है? 5 to 6 month, मतलब 20 to 24 weeks. Development start कब होता है? 3 to 4 month means 12 to 16 weeks. So accordingly your answer will change. So always read the lines very carefully ki what is being asked. Actual framing of the question might be different in the actual exam. So just remember the facts ki haan, development starts at 3 to 4 months intrauterine life and development is complete by 5 to 6 months. So accordingly your answers will change. Appear by का मतलब क्या होता है कि ridges दिख रहा है. दिख रहा है मतलब कि डेवलप हो जाएंगे तभी तो दिखेंगे ना. If it is written like starts to appear by, then we can go with 3 to 4 months intrauterine life. Now come to this one. Which of the following is used to identify the species of a forensic sample? ये तो simple है ना. This we have already covered in one of the questions. Precipitin test or DNA analysis, DNA based methods. What is the role of toluidine blue in forensic What is the role of toluidine blue? To highlight the micro lacerations of genitals. Micro laceration of genitals. एक्चुअली में जो क्वेश्चन होना चाहिए ना इसमें होना चाहिए फिंगरप्रिंट ridges develops by. Appear word is a wrong way to ask. अगर है ना कि develops by, which was the actual word in the actual exam, तो go with 5 to 6 months. Develops का मतलब होता है डेवलपमेंट कंप्लीट हो गया. करेक्ट. एक्चुअली में ये वर्ड होना चाहिए जो कि एक्चुअल एग्जाम में था, डेवलप्स. हियर इट इज लाइक अ टाइपिंग मिस्टेक. तो डेवलप्स वर्ड इज अ करेक्ट वर्ड. एपियर्स वर्ड क्रिएट कंफ्यूजन. तो एग्जाम में ऐसे वर्ड्स नहीं आते विच आर डबल मीनिंग्स. डेवलप्स का मतलब एकदम क्लियर है, डेवलपमेंट इज कंप्लीट. Come to this one. Identify the poisonous plant having yellow flowers and seeds which are contained in prickly capsules. तो ये कौन सा पौधा है? This पौधा is Argemon mexicana. Came as a spotter question. Also called as prickly poppy. Also called as prickly poppy. Prickly poppy. Nereum odorum is pink oleander. Papaver somniferum is poppy plant. So this was a simple question. Come to this one. In case of alleged, इसका आंसर बताओ. In case of alleged murder of A by B, बताओ आंसर. This type of evidences. This type of evidences. What is the thing which the witness has seen? The witness saw B with a knife on that day at that place a few minutes before the murder. He has not seen the crime occurring. He is not common witness, but he has seen something in relation to the crime. What is that something? Called as in law circumstantial evidence. अगर option में है तो best answer. If not in option, then the second answer will be indirect evidence, because indirect evidences can be circumstantial or hearsay. But because circumstantial is in the option, तो आपका best answer हो. So यहाँ पे the best answer goes with circumstantial evidence. I hope this topic is very clear. एक बार रिवाइज कर लेते हैं. Just quick recap. I can divide evidence outside courts because many of you are answering wrong. So I thought of covering this. Outside courts, evidence can be acquired by a witness, no? So outside courts, evidence is classified into direct and indirect evidences. Direct evidences is acquired by which witnesses? We know one is common witness of the case, also called as eyewitness of the case, because they have seen the crime occurring. They are eyewitnesses of the crime happening because they have seen the crime occurring. So they will always have first-hand knowledge about the crime. Another type of witness which acquires direct evidence is expert witness of the case, like doctors, like fingerprint expert, like ballistic expert. Any person whose findings is admissible in the courtroom, they become expert witnesses. Which type of evidence they have acquired? Direct evidences. Indirect evidences, on the other hand, is classified into circumstantial and hearsay. Anything which is indirectly seen in relation to a crime is circumstantial. Anything which is indirectly heard in relation to a crime is hearsay evidence. So what should be the best answer to this question? C saw B with a knife on that day at that place a few minutes before the murder. He has seen the accused with a weapon. So yes, this type of evidence, if circumstantial is in the option, our single best answer. If not in option, then indirect evidence. If I make a twist that C saw B killing the female, then your answer will become direct evidence, because now he has become a common witness in law or eyewitness in the law. Come to next question. Which of the following is associated with cocaine intoxication? So you have to pick the findings in cocaine poisoning. This is true. This is also true. This is also true. But cocaine is a mydriatic and it increases all the vital parameters. Hypertension, tachycardia, tachypnea, all the vital parameters are moderately raised. Heart rate, respiratory rate and blood pressure. So we know this fact, and because it leads to increased levels of excitatory neurotransmitters, that is why these vital parameters, they go up, and along with this, temperature of the body also rises. Cocaine also leads to cocaine fever by increasing those neurotransmitters. So yes, the correct answer will be all are true except D option. A is your correct answer. See the way of framing the question. But never be confused in this. You have made out D is a false option. Look for D false. You are ruling out two options. The moment you have solved this much, and then you can easily solve accordingly. Next one. Which of the following is the treatment of choice in arsenic poisoning? Treatment of choice in arsenic goes with dimercaprol given through intramuscular route, also called as British anti-lewisite. So British anti-lewisite is also called as dimercaprol. Why it is highly effective in arsenic poisoning? Because arsenic affinity was to inhibit sulfhydryl group of enzymes. PAL or dimercaprol is the same name. This chelator consists of lots of unsaturated sulfhydryl groups. More and more of arsenic combines with BAL, gets excreted from the body as a chelate complex. Okay? C is the correct answer. Come to next one. A 40-year-old chronic arsenic poisoning. What are the features? Aldrich mesaline is true. Raindrop. This is true. This is true. This is a feature of phosphorus poisoning, not arsenic poisoning. Phosphorus is a luminous poison. It leads to luminescent fecus and vomitus called as smoking stool syndrome, and then it damages the liver. So here the correct answer goes with 1, 2, 3 and 5. C is your correct answer. Identify the mechanical injury shown in the image. This question answer goes with cuts, also called as hesitation cuts. Goes with suicidal attempts or self-inflicted injuries. If the question answer was to be grazed abrasion, now you will see injuries without any blood stains. You will see something zigzag, zigzag. Grazed abrasion will also appear like that. But blood stains will be absent. Here you will usually see blood stains. Why? Because they are cuts. Vessels have been cut. Bleeding will be there. Dry blood stains will be there. So never get confused. Which one is which one? This is the way to discriminate or differentiate. इसका आंसर क्या होगा? Patient was brought to emergency with GCS. बहुत ही poor है GCS. He was intubated, sent for NCCT, which was found normal. The moment you see NCCT normal, all the options having bleeding or hemorrhage word will be ruled out. Contusion is also bleeding only. So I have ruled out SAH, EDH contusions and I have solved the question. Directly also you should solve the question. The moment you see a head trauma case, person unconscious, CT normal, think of DI. With which finding? When you got the MRI done, MRI showed you petechial hemorrhages in white matter. With petechiae in white matter. And this is a naked eye finding also. During time of autopsy, when we take sections of the brain, now we see these petechial hemorrhages in the white matter through naked eye. And on histopath, the cut axons in DI cases, they give a swollen appearance. Now, what is that appearance called? Retraction ball appearance. That is seen by a pathologist on histopath. Very good, very good. So, DI is a diagnosis of exclusion. When you exclude everything, then you write DI. In relation to head trauma. N-acetyl parabenzoquinolamine, shortly called as NAPQI, is toxic metabolite of which of the following? Answer goes with paracetamol. Sometimes they give you options like acetaminophen, means the same. And what is the antidote to remove this toxic metabolite from the body? We use either N-acetylcysteine. If not an option, you will see methionine in the option. So methionine also serves the same purpose. It also increases the glutathione stores of the body. N-acetylcysteine also increases the glutathione stores of the body. But why NAC is preferred? Because NAC additional mechanism is it also binds with NAPQI. It acts as a binder to NAPQI and helps in its excretion. So that is why NAC is the preferred antidote. Next one. One friend killed another because of having common girlfriend by compressing his nostrils and mouth. This is called smothering. So injuries in smothering cases will be seen over lips, like abrasions and bruises of lips, while sitting on his chest. If someone is sitting on the chest, means there is external compression of the chest. Means which type of asphyxia? Traumatic asphyxia. So both the mechanisms are playing a role. And his intention is to kill the person, means homicidal. Smothering and traumatic asphyxia in one word is called as burking. Overlaying will be answer if the mechanism is accidental. Which mechanism? Same mechanism. Smothering plus traumatic asphyxia. But mainly seen in which cases? Not general population. It is mainly can be seen in newborn cases, so where the parents were heavy weighted, quintal parents. I hope it is very, very clear. Come to next one. Patient was brought dead with multiple small puncture wound over right anterior chest wall, multiple abrasions and laceration over left over abdominal wall. What is the reason? The correct reason is hitting off different parts of the body by flying object will lead to a Marshall's triad of abrasions, bruise and laceration. So the correct answer goes with C. Barotrauma mainly injures those areas which were having a pressure change already, like ear area, like lungs area. So what is the most common injury in bomb blast cases? Tympanic membrane damage, preferred as an answer over lung damage. But here no external injury occurs due to barotrauma or shock wave. Flying missile is secondary bomb blast injury, correct? Barotrauma is primary bomb blast injury. Fall of the building or collisional injuries, they are tertiary bomb blast injuries, and quaternary bomb blast injuries complications of explosion like fire, fume, killing the person, or the person is having some psychiatric complications, post-traumatic stress disorder. So all this will be quaternary bomb blast injuries. Flying missile will lead to Marshall's triad of abrasions, bruise and lacerations. Abrasion, bruise and laceration. Next one. Blackfoot. This is a simple one-liner question. Arsenic is known to affect limb supply mainly of the lower limbs of the foot area. It causes vasospasm. So due to that vasospasm effect, foot can become black and gangrenous. So that is how the answer goes with arsenic. That is a conflict thing. Okay, Harsha. Underwater blast, na? That is a controversial thing. Controversial things are not asked in the actual exams. But if at all you have to remember, na, underwater bomb blast, what is the most common injury? Remember intestines. Intestines. That is why that question has not been asked in actual exam till date, and it will never be asked because it is highly controversial across different surgery textbooks, across FMT textbooks. So that is why underwater bomb blast will never be asked. But if at all you have to remember intestine damage is most common in underwater bomb blast. Come to this one. As per guidelines of snakebite management, right approach is to be used. What is not included in it? So R for reassurance, I for immobilize the bitten limb, GH for go to hospital immediately, T say tell the doctor. Come to this one. This is a hot favorite topic. Negligence topic ना अच्छे से रिवाइज करना मेन वीडियोस से. So जो लोगों ने ऑनलाइन ऑफलाइन कहीं से भी पढ़ा ना, इस टॉपिक को अच्छे से रिवाइज करना. नेग्लिजेंस टॉपिक को, ये INICET के लिए पर्टिकुलरली बहुत इंपॉर्टेंट है. All the doctrines of negligence, defenses of a doctor in negligence cases. So यहाँ पर आंसर क्या होगा? Patient comes to casualty with life-threatening injuries. There was no time for consent and the doctor started life-saving surgery with all the precautions. Death of the patient then also occurred. Doctor is not responsible. मतलब आपको क्या पिक करना है? Defense पिक करना है. So which of the following is a defense for the doctor? एक ही तो defense है. कुछ भी नहीं बताया तो भी आंसर सॉल्व कर सकते है ना. Res ipsa loquitur is not a defense for the doctor ना. Res ipsa loquitur क्या कहते हैं? Whenever obvious fault has been done by your doctor, the facts of the case speak for the patient. Now the courts will tell the doctor that prove that you are innocent because the facts of the case speak for the patient. So here the answer goes with doctrine of anticipation, also called as calculated risk doctrine. calculated risk doctrine. So this is mainly to cover even rare risk involved with a life-saving procedure. The doctor took the risk to save the life. So can the doctor start a life-saving surgery without consent? Yes. According to which section of law? A doctor can go ahead without consent for life-saving surgery. According to which section? Anyone? 30 section of Bharatiya Nyaya Samhita. This was asked in our NEET PG 2024 na. Very lengthy question. So there the crux of the question was, yes, for life-saving surgery, even if we do a procedure without consent, we are safe. IPCs खत्म हो गए. IPCs अब नहीं पढ़ने हैं. No need of reading 92 IPC. 92 IPC has become 30 section of BNS. अब आपके एग्जाम में ना IPC, CRPC खत्म हो गए. तो वो नहीं पढ़ने. You are very correct. 92 IPC has now been reframed under 30 section of BNS. Content same है, number change हो गया. BNS कौन कौन पढ़ने हैं? BNS चलो लास्ट में मैं लिख दूंगा सारे जो इंपॉर्टेंट है ना, वो लिख दूंगा. दैट विल बी. एक पीडीएफ मैंने अपने टेलीग्राम ग्रुप में भी शेयर किया हुआ है. फ्रॉम देयर ऑल्सो यू कैन टेक द हेल्प. दैट पीडीएफ हैज ऑल द इंपॉर्टेंट सेक्शंस. कंपैरेटिव टेबल है. IPCs, BNS, CRPCs, BNSS. इंपॉर्टेंट वंस हैव बीन रिटन देयर एंड मार्क्ड ऑल्सो. सो उसको आप देख सकते हैं. टेलीग्राम ग्रुप का मैं QR कोड आपको शेयर कर दूंगा लास्ट में. डॉक्ट्राइन्स ऑफ नेग्लिजेंस, दिव्य शक्ति पूरा पढ़ना, पूरा रिवाइज करना है. चलो एक बार रिवाइज कर लेते हैं. ठीक है, बस मैं बोल देता हूं, आप सुन लो. लाइक अ स्टोरी. नेग्लिजेंस टॉपिक इज लाइक अ स्टोरी ओनली. सो इफ आई स्पीक क्विकली ना, इट विल बी रिवाइज नाइसली एंड यू विल रिकॉल इट. बिकॉज कंटेंट तो आपके पास, नोट्स तो सबके पास होंगे, है ना. नेग्लिजेंस टॉपिक मीन्स डॉक्टर हैज डन अ एरर. Because of that error, it can be either act of commission or omission. So mild damage has occurred to the patient or gross damage has occurred to the patient. Mild damage को क्या बोलते हैं? Civil negligence. Gross damage को क्या बोलते हैं? Criminal negligence. In both the cases, the case is patient versus doctor. Indian legal system क्या कहते हैं? Accused is innocent unless proven guilty. This is our Indian legal system. One of the systems called adversarial system. So what is the adversary in Indian legal system? Accused is always taken as innocent unless proven guilty. Who has to prove the guilt of the accused? The victim side. In a case of patient versus doctor, who is the victim? Patient. Who is the accused? Doctor. Who will have to prove the guilt of the doctor? Patient. This is what is called burden of proof. Also called as onus of proof. Okay? ये पहला क्वेश्चन है कि burden of proof in civil negligence, criminal negligence किसके ऊपर होता है? हमेशा victim के ऊपर होता है. तो मेडिकल नेग्लिजेंस के केस में हु इज द विक्टिम? पेशेंट. दिस इज वेरी क्लियर. नाउ कमिंग टू द सिचुएशन इन सिविल नेग्लिजेंस केसेस, दिस पेशेंट यूजुअली गोज टू कंज्यूमर कोर्ट्स फॉर मॉनिटरी कॉम्पनसेशन. इफ हिज कॉम्पनसेशन डिजायर्ड इज अप टू 1 CR, he will go to district consumer courts. For more than 1 CR to 10 CR, he will go to state consumer courts. For more than 10 CR compensation, he will go to national consumer courts. ठीक है? This is as per Consumer Protection Act guidelines, which were changed in 2019, the last updated act. Then in criminal negligence, the patient can go to consumer courts for compensation, monetary compensation, as well as he can go to a police station. So in relation to death of a person due to negligent act, ये section important हो जाता है. In relation to negligent act leading to death of a person by doctor, means negligent act was done by the doctor and this has led to death of the patient by the doctor. So the section now applicable is 106 section of BNS and that to subsection 106 A IPC. तो वो खत्म हो गया ना अब तो. तो ये ध्यान में रखना है. ठीक है, तो ये इंपॉर्टेंट सेक्शन हो गया ना. इन रिलेशन टू नेग्लिजेंट एक्ट लीडिंग टू डेथ ऑफ अ पर्सन, 106 सबसेक्शन 2. पर्टिकुलरली डॉक्टर्स के लिए सबसेक्शन 2 बनाया गया है. सबसेक्शन 1 है फॉर जनरल पॉपुलेशन, लाइक रोड ट्रैफिक एक्सीडेंट्स लीडिंग टू डेथ ऑफ अ पर्सन, सो उनका होगा 106 सबसेक्शन 1. डॉक्टर की नेग्लिजेंस से इफ द पेशेंट डेथ अकर्स, सबसेक्शन 2 विल बी एप्लीकेबल. अर्लियर फाइन एंड इम्प्रिजनमेंट अलग अलग थे, 2 years और फाइन, इन दोनों को क्लब कर दिया गया. सो दिस इज अ थिंग which was challenged by our medical associations also कि ऐसा तो ये तो गलत है ना. Earlier the punishment was 2 year or fine. Now they have clubbed both the things. So this thing should be remembered, one of the important updated changes. So this is how civil and criminal negligence cases go. Now what are the important doctrines? RIL you all know, I think, res ipsa loquitur. Wherever obvious fault has been done by a doctor, like surgical instruments found within the body cavity. So ऐसे केसेस में क्या करते हैं? ऐसे केसेस में the facts of the case speak for the patient. The judge will say patient side need not prove many things because the facts of the case, like this X-ray telling me the scissor inside the abdominal cavity is proving that the doctor has left the scissor. Let the doctor prove that the scissor was not left by him. यहाँ पर क्वेश्चन कैसे फ्रेम हो सकते हैं? Burden of proof with respect to innocence in RIL cases lies on whom? तो बर्डन किस पे शिफ्ट हो जाता है? डॉक्टर पे. Now he has to prove that he is innocent, which almost becomes impossible. This is clear, I think. Now come to vicarious liability. Vicarious liability is also called as respondeat superior or captain of ship doctrine. So this simply says employer-employee relationship was there, and if employer was under direct supervision of the employee, so now employer is also responsible for negligence of employees. Means first year PG ने negligence करी है तो उसको दुखी नहीं होना है. First year PG will take his second year PG, third year PG, unit head. ये सब लोग can become responsible because they were under direct supervision of first year PG. So in medical science, you should always be fearless. Should always be fearless. So this is according to vicarious liability. इसका छोटा भाई, the younger version of this vicarious liability is borrowed servant doctrine, which basically tells employer or senior is also responsible for negligence of hired or part-time employees. You cannot say that so and so worker or employee is a part-time employee, so I should not be held responsible. There also the employer of that part-time employee will also be held responsible. I hope the doctrines are clear. डिफेंसेस तो बहुत सारे, डिफेंसेस को मेन वीडियो से कवर कर लेना, ठीक है. डिफेंसेस टोटल 11 डिफेंसेस आर देयर, so they have been covered nicely with particular examples and important pointers. So revise it from the main videos. Now come to next question. Identify the injury shown in the image. हाँ बस हो गया, थोड़ा देर और 10-15 minutes, मुझे भी भूख लग रही. Identify the injury shown in the image. Quickly करते हैं. This is incised wound ना, ये तो क्लियर है ना, incised wound है, इसमें तो कोई तकलीफ नहीं है किसी को. ये क्लियर कट क्लीन कट मार्जिन है with no tissue connections between the two edges. ये तो क्लियर कट इंसाइज्ड वुंड है ना, इसमें क्यों परेशान हो रहे हो? इसको क्यों सी बोल रहे हो? इंसाइड लुकिंग लैसरेटेड क्यों बोल रहे हो? इसको कहते हैं बायस होना. उसके लिए इंसाइड लुकिंग लैसरेशन के लिए आई विल शो यू द हेड एरिया and I will show you a split like this where the margins will be irregular, not clean cut like this. I will show you the head area, I will show you irregular margins. तो यहाँ margins कहाँ irregular है? Margins पूरे पूरे clean cut है, तो इसको क्यों split laceration बोलेंगे, है ना? This we cannot call split laceration. Res judicata and res indicata difference, Kartika, is na? See, res judicata says case once decided, the file is closed. Mainly in civil negligence cases, what happens is, for 5 lakh compensation, patient has filed a complaint. He was given 4 lakh compensation, he was happy. There is a time of appeal period. He did not even make an appeal that I should get only 5 lakh compensation, I am unhappy. He did not make an appeal to higher consumer courts. After 1 year, he thinks, let me refile the case for more than 1 CR compensation or for 10 lakh compensation again. Answer is he cannot. Case once decided, the file is closed. after the appeal period is gone. Then comes res indicata. Res indicata says every negligence case, mainly civil negligence cases, should be filed within 2 years of occurrence of negligence. A sort of defense for us, na? Patient cannot file the complaint after 2 years. Next one. All of the following are associated with burns of hydrofluoric acid represented as HF6. तो आंसर बताओ एक्सेप्ट का. इस वर्ड को कभी नहीं भूलना है. All of the following are seen in HF6 exposure except B. All other are true things. So hydrofluoric acid leads to hypomagnesemia, hypocalcemia, as well as increases H plus ions in the body. Okay. This is the last single answer type questions. उसके बाद 2 or 3 मल्टीपल करेक्ट वाले हैं, उसमें लीड टॉपिक्स रिवाइज करेंगे. Correct composition of black gunpowder is a repeat question. So remember, black gunpowder is used in shotgun cartridges, and the mnemonic to remember is PCS, potassium nitrate, charcoal and sulfur. More the number of alphabets, more is the percentage. तो देखना है सबसे ज्यादा परसेंटेज किसका होगा. पोटेशियम नाइट्रेट 75%. Then comes charcoal has more alphabets, 15%. Sulfur 10%. Correct answer is option C, not B. C is the correct answer. So PCS in the form of 75, 15 and 10% makes your black gunpowder. इसको सॉल्व कर लो, इसको सॉल्व करो तसल्ली के साथ. This will increase your confidence. I have made some twist in the original question ताकि आपका ये ना पूरा टॉपिक रिवाइज हो जाए. करेक्ट कॉम्पोजिशन ऑफ ये ट्रू अबाउट फ्रेश वाटर ड्रॉनिंग. हाँ, मल्टीपल करेक्ट. पिक करो ट्रू स्टेटमेंट्स फॉर फ्रेश वाटर ड्रॉन. तो करेक्ट है. फ्रेश वाटर ड्रॉनिंग में क्या क्या होगा. हीमोडाइल्यूशन होता है बिकॉज द मूवमेंट ऑफ वाटर इज टुवर्ड्स वैस्कुलर कंपार्टमेंट लीड्स टू रप्चर ऑफ आरबीसी. सो उसकी वजह से क्या होता है. हाइपरकैलेमिया होता है. ये भी सही है. And hemodilution से all the electrolytes will go down, means except potassium. Potassium क्योंकि RBCs are rich in potassium, so इसलिए hyperkalemia leads to ventricular fibrillation there. So arrhythmia भी correct है. ठीक है, but ये तो गलत है फ्रेश वाटर के लिए. केवल करेक्ट वाले मार्क कर लेते हैं. डैमेज ऑफ टाइप 2 alveolar cells will be due to water in the alveoli. हाइपरक्लोरीमिया भी गलत है. हाइपोमैग्नीसीमिया सही हो जाएगा. ठीक है. So this all is true for fresh water. Same question for salt water. अब सॉल्व करो. सेम क्वेश्चन फॉर सॉल्ट वाटर. सॉल्ट वाटर में क्या होता है. हीमो कॉन्सेंट्रेशन. हीमो कॉन्सेंट्रेशन से क्या क्या होगा. ऑल द इलेक्ट्रोलाइट्स विल बी रेज नाउ. हाइपरनेट्रीमिया मिलेगा, हाइपरक्लोरीमिया मिलेगा. डैमेज ऑफ टाइप 2 alveolar cells is a common damage along with myocardial anoxia due to the water in the alveoli. All these damages happen. And cardiac asystole and pulmonary edema leads to death in salt water drowning cases. ठीक है. So accordingly आपको पिक करना है. ठीक है, ऐसे रिवाइज हो जाएगा आपका फ्रेश वाटर सॉल्ट वाटर का डिफरेंसेस इजी. इसमें आपके नेगेटिव मार्क्स किसमें होते हैं. व्हेन यू हैव मार्क्ड अ करेक्ट थिंग एज रॉन्ग एंड अ रॉन्ग थिंग एज करेक्ट. So mark these questions very carefully. जो पता है वही मार्क करना. Don't do negative marking in these questions. जितना पता है उतना भी मार्क करोगे तो आपको मार्क्स मिल जाते हैं. But if you do negative marking here ना, तो आपके करेक्ट वाले भी खत्म हो जाते हैं. Come to next question. इसको सॉल्व करो. Alleged case of rape offense has occurred. The female was brought by parents to hospital. What are the duties of a doctor in sexual assault victim case? Pick the ट्रू स्टेटमेंट्स. मतलब व्हाट आर द ड्यूटीज ऑफ अ डॉक्टर, मतलब ट्रू पिक करना है. मल्टीपल करेक्ट टाइप. डिटेल्ड हिस्ट्री टेकिंग एंड इंफॉर्मेशन टू द पुलिस. यस देंगे, करेक्ट है. कलेक्ट स्वैप्स इफ कंसेंट नॉट गिवन फॉर एग्जामिनेशन. दिस इज टोटल रॉन्ग. You cannot collect swabs if consent is not given for examination. That is total wrong statement. Will you document refusal if consent not being given even after psychological counseling? Yes, for our own safety. Will you conduct examination without consent? Never ever. Will you provide treatment? Yes, treatment तो देंगे ना injuries के लिए. Will you rule out blood samples? Will you keep blood samples to rule out STDs? And will you do USG to rule out pregnancy or UPT to rule out pregnancy? Yes. Can you take consent from female if the age is 12 or more than 12? Yes. So ये सब हमारे true statements. बाकी सब गलत है. So these are the 5 lines which we should always remember. अभी recent INICET में क्या पूछा गया था? What is the first thing to be done by a doctor? सबसे पहले क्या करेंगे? You will take a detailed history ना. You will come to know so as to what the case is all about. Then only you will proceed. Will you inform police? Yes. Indirectly, this thing is written under which section? 33 section of Bharatiya Nagrik Suraksha Samhita, which have replaced our CRPCs. नहीं 18 नहीं है, 12 है. कब से है 12? Since 2014 according to MOHFW guidelines which were published way back in 2014 and is still valid. A victim 12 and more than 12 examine legally also na, this is correct. Law also says if a person is 12 to 18 they can give consent for examination because examination is not going to cause any harm to the person. Wherever a harm factor is involved, according to law also, the age of consent will be 18 or more than 18. Examination से victim की जान थोड़ी चली जाएगी. Examination will benefit her. So that is how general physical examination या कोई भी examination purpose के लिए what is the cutoff age? 12 or more than 12. Next, match the next multiple correct type. Multiple correct. Which of the following is not included? हाँ, less than 12 है ना, then take consent from guardians. There the role of guardian comes. Basically, the child has been empowered. That let us take consent from the child because usually the perpetrators na, when offences happen to a child na, usually the accused people used to be known relatives or the parents sometimes, druggist parents, psychotic parents. So they used to, they were not giving consent for medical examination of the child. So sample collection was not happening. So MHFW way back in 2014 empowered the child itself. That let us give power to the child that their consent will also be valid. So here the correct answer goes with which is not included. Alcohol is non-narcotic substance, nicotine is non-narcotic, while I think all other options are narcotic drug and psychotropic substances. Narcotic drug list consists of cannabis, cocaine, opium and poppy straw. Poppy straw is the dry husk of poppy capsule. Psychotropic substances list is very long. Important agents being LSD and amphetamines. Poppy straw is the dry husk of poppy capsule. उसको भी नार्कोटिक ड्रग की लिस्ट में रखा गया क्योंकि अफीम निकालते ना पॉपी कैप्सूल से. It's not that 100% अफीम is extracted. कुछ traces रह जाते. The plant dies and that dry husk still contain अफीम. If the government has not kept this as narcotic drug, na, people will sell the dry husk of poppy capsule itself. So that is why it is kept as narcotic drug. Multiple correct. Pick the true statements about the burn shown in the image. You all must have gathered na कि हाँ ये filigree burns है. So ये वाला तो true है ना. This is also called chronographic markings or filigree burns. This is also true. This is brownish pink in color. Does it follow major nerves and blood vessels? नहीं, ये गलत. This is wrong. Will it fade out itself or disappear in 1 to 2 days? Yes. Is it seen in all cases of lightning burns? No. It is seen in about 30% of lightning burn cases. So what is correct is B, D, E. 3 options are correct. अब मैंने एक लिस्ट बनाया है जहां से ना INICET में मैंने भी ऑब्जर्व किया फॉर लास्ट 10 years. ये एक पर्टिकुलर क्वेश्चन है जो पूछते हैं. What is being asked in our INICET exam is what is the cause of death? COD means cause of death. So एक बार समराइज कर लेते हैं. SDH is the most common cause of death in battered baby syndrome, also called as Caffey syndrome or shaken baby syndrome. And इसके साथ याद रखना SDH is also the most common cause of death in acute boxing injury. Boxing injury. Vagal shock is the most common cause of death in hydrocution cases, which is also called as drowning in cold water or immersion syndrome. ठीक है, vagal shock, and this is also the most common cause of death in cafe coronary syndrome, where recurrent laryngeal branch of vagus is mostly seen to be implicated in causing death, immediate death of an elderly alcoholic person. Ventricular fibrillation, we all know, freshwater drowning. Pulmonary edema plus asystole, we all know, salt water drowning. This is the most common cause of death there. Laryngospasm, we all know, dry drowning. Dry drowning. D for drowning. Electrolyte imbalance is the most common cause of death in post-immersion syndrome, where a wet drowning case dies after 24 hours of drowning. So cases become post-immersion syndrome cases or secondary drowning cases. So most common cause of death is electrolyte imbalance. Asphyxia is the most common cause of death in complete hanging. Cerebral hypoxia is the most common cause of death in partial hanging. So ये आपके important cause of death एक जगह summarize हो. ये एक potential question area for particularly for INICET exams. So this completes our session. And this is my Telegram group where you can find that PDF in relation to the new legal changes ना, वो मैंने mark भी किया हुआ है, so that you can refer to for new numbers, only the important ones. Legal section से वैसे भी questions नहीं आते. I will particularly help you remember कि कौन से sections important है. See, the sections related to abortions, then the sections related to injuries. Abortion के sections नए laws में 88 से 92 section of BNS के बीच में, they are lying between 88 to 92 भारतीय न्याय संहिता. Injury sections कहां से कहां तक पढ़ने हैं? 114 to 118 and also 124. 124 now deals with acid attacks. उसके बाद रेप का डेफिनेशन एंड रेप का पनिशमेंट, इसके जो दो सेक्शंस हैं, दैट इज 63, 64. देन डाउरी डेथ का सेक्शन हैज बिकम नंबर 80. Perjury number has become 227 for definition and 229 for punishment. ये हो गए इंपॉर्टेंट BNS सेक्शंस. इसी तरह से भारतीय नागरिक सुरक्षा संहिता sections, they have also been marked. So just go through the PDF and you will find it very, very handy. Just go through the numbers and now the new numbers are very easy. Important change कहां पर है? Grievous hurt के clauses में, उसको ध्यान में रखना. Grievous hurt 8th clause. What is the change there? What is the change? Instead of 20 days, you will find if the person goes in severe body pain or is unable to do his routine pursuits, daily routine activities or ordinary pursuits for 15 days, hurt will become grievous. This is one of the significant changes. फिर और significant changes हमारे laws में क्या है? In relation to power of judges. Power of judge में ना एक important change क्या किया गया है? In relation to fine powers, you will see this change. That पहले आप पढ़ते थे ना, second class judicial magistrate. What was the fine power of second class judicial magistrate? Earlier 5,000, which has increased to 10,000. ये एक important change है. And second change is in first class judicial magistrate fine power. Earlier it was 10,000, which has been increased to 50,000. ये दो most important changes हैं हमारे laws में, from where MCQs can be asked. ऐसे तो है तो बहुत changes. What is important is at least cover this much. Please explain cafe coronary syndrome. Cafe coronary syndrome एक बार समझ लेते. देखो, choking and cafe coronary. Choking can occur in any age person. Cafe coronary mainly seen in elderly alcoholic person. इन दोनों का definition एक ही है. What is choking and cafe coronary? Death of a person due to obstruction of upper respiratory tract by a foreign body. वो फॉरेन बॉडी कुछ भी हो सकता है, फूड बोलर्स कुछ भी. इट कैन बी अ चोकिंग केस, इट कैन बी अ कैफे कोरोनरी केस. चोकिंग केस किसी भी एज ग्रुप में हो सकता है, बच्चों से लेके बूढ़ों में, चाइल्ड टू ओल्ड एज. बट कैफे कोरोनरी मेनली इन एल्डरली अल्कोहलिक इंडिविजुअल्स. ये पहला डिफरेंस है. Second difference, there is a probability that the patient life can be saved and the person will show you features to save himself like coughing, gasping, air hunger. ये सारे signs मिलेंगे choking में. Eventually, you can do hemorrhage maneuver also. Stand behind the person and give a thrust to his abdomen so that the foreign body get dislodged. या फिर emergency tracheostomy कर सकते हैं, mid tracheostomy between second to third tracheal rings to save the life of the person. If the person dies, I will write the cause of death in my autopsy report as asphyxia as a result of antemortem, obstruction of antemortem, choking. And there I will tell in the courtroom that I found a bolus and I will see the signs of asphyxial deaths in the dead body. Petechial hemorrhages, cyanosis of nails, congestion of organs. But in a café coronary syndrome case where the elderly was having a food bolus in the upper airways, what happened was death happened immediately. He will not show you any signs and symptoms to save himself because the death has happened immediately. There is no chance to save the life of the person. So on molecular autopsy, what was discovered was that the person usually dies due to vagal nerve endings of the airways getting stimulated somehow due to that foreign body. And which branch of vagus is mostly implicated? Recurrent laryngeal nerve. I hope it is clear. कुशाग्र. Conjugated करके कुछ नहीं होता है. Extended consent basically is like a blanket consent. What is blanket consent? At the time of admission of the person, you take a general consent form, which is followed in many countries outside India, not in India. Blanket consent. So what is that? That is giving you extended consent for any surgical or medical procedure. But in India, what is the situation? Consent has been taken for hysterectomy. That consent is limited to that procedure. If you want to do some other procedure, take a proxy consent from the relatives if the patient is unconscious or on OT table. ठीक है? Clear? So extended consent is not valid in India. Also called as blanket consent. Almost synonymous to the word blanket consent. Important BNS in medical jurisprudence. तो यही तो लिखा है अभी. यही सब तो most important वाले. And in fact, they have been marked in the PDF which is there in my group. इस session का PDF I will share in the DBMCI Premier group as well as my group. ठीक है? So DBMCI Telegram group है ना, Premier group. There also I will be sharing this. So no need to worry about the PDF and all. So revise your sessions nicely. Revise your content nicely and don't read anything new. Now is not the time to read anything new. Whatever you have read, just keep on revising that. Have that belief on yourself and you will do good in life. But first thing is, you should believe yourself that yes, I can do it and you will do it. You will do it nicely. अब देखो नंबर तो मुझे याद नहीं कि फर्स्ट क्लास है कि कौन सा क्लास है, बट हाँ 2-3 सब्जेक्ट्स हो रखे हैं. And so all the 19 subjects will be covered one by one. चलो जी, बाय बाय, गुड नाइट. आप लोगों को बहुत देर भूखा रखा मैंने, सॉरी फॉर दैट. बट सॉरी नहीं बोलना चाहिए, ठीक है, इतना तो मेहनत करना है. वी डॉक्टर्स आर हैविंग सुपर पावर्स ना, वी आर सुपर ह्यूमंस, ऑलवेज बिलीव दैट. हम लोग कुछ भी अचीव कर सकते हैं. इफ यू हैव दैट विल पावर ना, कुछ भी अचीव कर सकते हैं. यू विल अचीव गुड रैंक इन योर एग्जाम्स. ऑसिफिकेशन सेंटर्स इंपॉर्टेंट वाले जो क्लासेस में हमने कवर करे ना, उन्हीं को रिवाइज करना है बस. इंपॉर्टेंट वंस व्हिच हैव बीन कवर्ड इन क्लासेस. चलो जी, बाय बाय, बाय बाय. And for any of your queries, you can clarify those queries with me for my subject, obviously for my subject, in my Telegram group or Insta, whatever you follow. Okay, और इन DBMCI प्रीमियर ग्रुप, जो आपकी श्रद्धा हो, जहां आपको आसानी है. बट डाउट्स अपने माइंड में नहीं रखना, उसको क्लियर कर लेना. Chalo ji, we will be ending the session. Bye bye. Thank you very much.